Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you have symptoms like a fever for many days, or maybe you have joint pain and swelling around the joints, or maybe you have signs of an infection like a cough and a cold, or redness or swelling somewhere in your body, then your doctor may recommend something called the CRP test. And today I'm going to tell you everything about this blood test. First of all, what is CRP? So whenever you fall ill or your body is under any kind of attack or duress, or you have some kind of an autoimmune condition, your body needs to fight against this and defend itself. And one of the ways in which it does this is that the liver begins to create certain proteins, and these proteins rise very fast immediately after the attack or insult. So let's say you're infected with a bacterial infection or a viral infection which is giving you a cough and a cold, your liver will immediately begin to produce certain proteins which it will use to fight against that. One of these is called C-Reactive Protein, and that's why the name is CRP. This is a protein which is called an acute phase reactant. What that simply means is that it rises very fast in the initial part of any kind of infection or inflammation in your body. The C-reactive protein test just measures the level of this protein in your blood. How does the C-reactive protein actually help? So based on your levels, doctors can try to figure out whether you have an infection or some kind of an inflammatory process in your body. And if you have an infection, the levels of CRP can also help us know the type of infection, although this is not the best way to do it. Depending on the levels, we can even try and distinguish whether it's a bacterial infection or a viral infection. It also helps us in diagnosing things like flare-ups in patients of arthritis, which is joint swelling and pain. When their disease worsens, the CRP levels tend to rise. Also, CRP has been proven to be a predictive marker of heart disease. That means people who are at risk of having a heart attack, it has been found that their CRP levels tend to be higher than those who don't have this tendency. So monitoring CRP in even healthy people is useful to predict or know the risk of having future heart disease. These are some of the reasons why we do a CRP test. What are some of the symptoms that mean that you should get a CRP test done? I've already told you some of these at the beginning of the video, but here's a complete list. Fever, feeling tired or fatigued, pain anywhere in the body, swelling, chills, which is just fever and feeling cold, redness, as well as weakness and malaise, which is the generalized feeling of ill health, are all symptoms which are probably mean that there is some kind of an infection or inflammation somewhere in your body, and the CRP test will be one of the blood tests that is advised as a group of tests done to know the cause. So what does this test help doctors to know? The first is whether you have an infection or not. Very high CRP values are usually associated with some kind of an infection. Inflammation monitoring, whether the treatment that they are giving you to treat your condition is working or not, because if the inflammation reduces, the CRP level will also reduce pretty fast. Thirdly, cardiovascular risk. As I told you, CRP helps us predict whether you could have heart disease in the future, so it's a very useful marker for that. Autoimmune assessment, patients with autoimmune diseases or diseases in which the body's proteins attack its own tissues like lupus or rheumatoid arthritis, for example, CRP levels will be elevated in these diseases, and it helps us to know about to diagnose flare-ups of these diseases. And lastly, treatment response. If you've got the right treatment, the right antibiotics, the infection is coming down under control, your CRP levels will drop and help doctors to know that they are currently on the right track. So how is this test done? This is a simple blood test. We need a single sample of your blood. It will be drawn by inserting a needle into the vein of your arm. A couple of ml of blood will be drawn, and this will be processed in the lab. You should have the result by the same day or maybe on the next day. The results are usually mentioned in milligrams per liter. You can do the test at any time. You don't need to be fasting before this test. There are no special precautions. You can take all your usual medicines. Some antibiotics like carboxypenicillins may decrease the CRP levels. So please inform your doctor if you're on any of these, on this class of medications. What is the normal level of CRP? So in all age groups, less than 5 mg per liter is considered to be normal. 5 to 10 implies a mild elevation. 10 to 100 is a moderate inflammation, and anything more than 100 is a severe infection or inflammation. To measure your risk of cardiovascular disease, we use a slightly modified form of CRP which is called hs-CRP or high sensitivity CRP. It's nothing but the same thing like CRP, but it is measured by a different and more sensitive technique which is capable of quantifying CRP levels at even very low levels. So hs-CRP can measure very low levels of CRP even below 1 mg per liter. And to make sure that you're not at cardiovascular risk, your hs-CRP level should be less than 2 milligrams per liter. So when do we get abnormal results in the CRP test? Infections like pneumonia, which is an infection of your chest, where you have a lot of cough, cold, and fever. Sepsis, where there is an infection in your in your whole body, maybe in your blood. Urine infections commonly elevate your CRP, so you have burning and it pains while passing urine. That is a urine infection which will increase your CRP. I already told you about autoimmune diseases like arthritis, where there is swelling and pain in your joints, or lupus. We also have an elevated CRP level when someone has an accident, or patients with burns. Inflammatory bowel diseases like Crohn's or ulcerative colitis will also give you a high level of CRP. And last but not the least, even patients who have had a heart attack will show elevated CRP, because it's one of the proteins that will go up in the initial phase.